My name is Alan Davis. I'm the Professor of Vascular Surgery at Imperial College London. I also have the pleasure of being the Editor-in-Chief of the journal Phlebo-lymphology that is published by Sage. I have a long track record in other journals and I'm very keen on helping more junior colleagues develop a writing style that they can communicate in journals and also with respect to presentations either in the oral or the poster form. With respect to scientific writing, it is very important that the individual considers what the journal or magazine or abstract they are writing and what the aim of this is for. If we mainly focus on looking at writing for a journal, the key things are initially to decide, one, what you want to write about. Have you, two, considered who your co-authors are going to be? If it is a clinical trial or a basic science project, what are the appropriate numbers that you need so that you can then calculate the appropriate statistics? And if you are having issues with respect to looking at the appropriate statistics, it is very important to involve a statistician in the process. Once you have decided on your project, it is very important then to look at the journal that you're writing for as to what are the actual key instructions for the authors. For example, different journals will have a different abstract form. They may wish their abstract to be divided into an introduction, a methods, results and conclusion section, whereas others will not. And it is very important that you follow the instructions, because one of the main issues that reviewers and editors will often have is the fact that people have not followed the guidelines. This gets the reviewer into a bad mood at the very time of the review and may actually result in subsequent rejection of your article. Once you have followed the instructions and are just in the process of being ready to submit, it is very important that if your first language is not English and you're submitting to an English journal, to actually have it read through by a fluent English speaker just to correct grammar. Often many journals will actually have a junior sub-editor who will actually correct the English, so it should not be regarded as an absolute disincentive to submit an article if you feel that the English is not perfect. Once the article has been reviewed, often by 2 or 3 reviewers, you will then find that you will either get a letter back saying that you have accepted it, that it may need revision, or it may need revisions but actually with a resubmission, or you may get an overall rejection. It is very important that if you get some minor revisions, that you actually answer those revisions clearly, and it's very clear how you have or have not amended the article. Occasionally the editors and the reviewers may not actually have made the right decision with respect to something that you have commented on, and if you feel that the comments are inappropriate, it is actually important for you to actually say, well, actually, no, we do not think that the reviewers are correct, and give a reason for this, and this will then be looked at very clearly. So the key thing then is, once you have had your article accepted, you will get the proofs back to look at them, and this is the final stage that you have to actually correct the article. The key thing is that when you look through these proofs is that you look to make sure that the spelling, and you answer any questions that the editors have asked, but also that the figures are in the right orientation and that the right legends are with the right thing. Then the key thing is that after you have got that back, you will hopefully have your article published electronically first of all, and then there will be a paper copy. For those people who suffer a rejection of an article, do not be downhearted, because often people find that it is because of the nature of the content that it has not been accepted for publication by a specific journal. And the key thing then is to take on board some of the comments of the reviewers and resubmit it to a journal that may or may not be more specific with respect to what you are trying to do. And the key thing is that most people like the feeling of having had their article published, and it is obviously to the benefit, hopefully, of patients and to how we treat patients in the future. And obviously we all get a pleasure from seeing our name in lights. So, ladies and gentlemen, I would very much want to encourage you all to write, submit articles to journals and abstracts to the various meetings worldwide, But also remember that there are publications such as magazines and newspapers which you may want to contribute to advertise your own services, but also what treatments are available to help our patients. So the key thing I'd like to say to you all, that publication in whatever format is the key to getting the word out to what treatments we can offer our patients to make them have a better quality of life and a good outcome. Thank you very much.